Here's a shocking reality that should concern every parent in America. The nation's top vaccine advisory panel is being systematically transformed by individuals who fundamentally question the very science they're meant to protect. This week marks a pivotal moment as 5 newly appointed advisors prepare to take their seats on the Advisory Committee on Immunization Practices, ACIP, the influential body that guides vaccination policy for the Centers for Disease Control and Prevention. But here's where it gets controversial. These aren't your typical public health experts with decades of immunization experience. The announcement, made jointly by the CDC and the Department of Health and Human Services this Monday, represents what many consider a dramatic shift toward anti-vaccination sentiment within America's premier vaccine oversight committee. What makes this particularly alarming? Several appointees bring minimal documented expertise in vaccination science, while others have spent years actively challenging the safety and efficacy of vaccines and established disease prevention strategies. And this is the part most people miss. This isn't happening in isolation. These appointments come directly after a wave of resignations from seasoned health officials who reported being sidelined or coerced into participating in what they described as unscientific decision-making processes. These departing experts specifically cited concerns about politically motivated changes to COVID vaccine eligibility criteria and public access protocols. Tara Smith, who serves as an epidemiology professor at Kent State University's College of Public Health, didn't mince words about the selection criteria. The evidence suggests these individuals were selected not for their deep vaccination expertise, but precisely because they've established themselves as vocal critics, particularly regarding COVID vaccines. Given the committee's published agenda, I'm deeply worried they'll leverage these positions to impose further restrictions on vaccine accessibility. But the implications extend far beyond individual appointments. Jessica Steyer, a respected public health scientist who founded Unbiased Science, emphasized that the real concern lies in the systematic nature of these changes. What we're witnessing isn't about individual committee members. It's the deliberate replacement of career vaccination specialists with political appointees who have publicly challenged well-established vaccine science. Steyer's timing concerns are particularly urgent. We're facing this upheaval at the worst possible moment. Measles outbreaks are currently spreading across communities. Respiratory virus season is approaching rapidly. When policy decisions get based on misinterpreted or cherry-picked data, the real-world consequences are immediate and potentially devastating. Even if these votes ultimately support vaccine recommendations, the public damage from amplifying vaccine skepticism and anti-vaccination messaging is already being done. The stakes couldn't be higher for the upcoming Thursday and Friday sessions, where ACIP members will cast critical votes on 3 essential vaccines: the combined measles, mumps, rubella, and chickenpox immunization, the hepatitis B vaccine administered at birth, and COVID vaccines for various age groups. Here's what every parent needs to understand about these votes. They directly impact your family's healthcare options. As Steyer explained, these upcoming decisions pose a genuine threat to parental choice in healthcare. Without official ACIP recommendations backing these vaccines, insurance companies may refuse coverage. The Federal Vaccines for Children program could discontinue providing them entirely. Families who desperately want to protect their children's health may suddenly find themselves unable to access these life-saving immunizations. The potential consequences are already becoming visible. According to the former CDC vaccination chief, the committee may push the hepatitis B vaccine recommendation from birth to 4 years of age, a change that could reverse decades of progress. This vaccine has successfully reduced hepatitis B infections among young Americans by an astounding 99%. Delaying its administration could trigger a resurgence of this serious liver infection across the United States. Additionally, the committee appears poised to further narrow COVID vaccination recommendations, potentially leaving vulnerable populations without adequate protection. Steyer warned about the committee's likely tactics. We're anticipating they'll present unverified reports from the Vaccine Adverse Event Reporting System, as though they represent confirmed vaccine-related deaths. This approach is equivalent to treating every emergency 911 call as definitive proof that a crime occurred. So who exactly are these controversial new appointees? Their backgrounds reveal a consistent pattern of vaccine opposition, particularly regarding COVID immunizations and public health precautions. Catherine Stein serves as a professor in the Population and Quantitative Health Sciences Department at Case Western Reserve University's School of Medicine. However, her public writings reveal a troubling blend of religious ideology and medical advice. In January 2021, she wrote, "Remember, the Lord Jesus did not fear lepers, and leprosy was and continues to be a highly contagious infectious disease. Not only did he heal them, but he touched them. He showed no fear, nor did he practice social distancing." Stein openly admitted that religious beliefs motivated her rejection of basic health precautions like face mask wearing, which she characterized as a symbol of fear that supposedly harms the wearer's health, a claim contradicted by extensive scientific evidence. She argued that as Christians, we should not fear death and claimed, "This virus is not the scary killer the media and government portray it to be," even while deadly COVID waves were claiming hundreds of thousands of American lives. During her personal time, Stein has collaborated as a researcher with Health Freedom Ohio, an anti-vaccination organization aligned with Children's Health Defense, the prominent anti-vaccine group previously led by Robert F. Kennedy Jr., who now heads the Department of Health and Human Services. In February 2020, she endorsed a letter urging then-President Trump to reconsider school and daycare vaccination requirements and to prioritize ending the persecution of the unvaccinated people of faith. Kirk Milhoan, a pediatric cardiologist, has campaigned against COVID vaccines based on the extremely rare risk of myocarditis, heart muscle inflammation. Despite overwhelming evidence of vaccine safety and the far greater cardiac risks posed by COVID infection itself, Milhoan declared, "We should halt vaccination programs and conduct additional testing before proceeding." He told KFF Health News in March that this approach was necessary despite the minuscule risk profile. Milhoan serves as a senior fellow with the Independent Medical Alliance, previously known as the Frontline COVID-19 Critical Care Alliance, an organization that promoted ineffective and often dangerous ivermectin treatments for COVID patients. The Hawaii Medical Board filed formal complaints challenging his medical license, though he ultimately retained his practicing privileges. Evelyn Griffin represents perhaps the most dramatic career shift among the appointees. Once a practicing obstetrician and gynecologist, she transitioned into what she calls holistic health. At a Louisiana Health Freedom Day event in May 2024, Griffin directly questioned vaccine safety. When the COVID vaccine was released, other physicians blindly believed the vaccine caused no harm. During medical school, we learned about childhood vaccines. We were taught they were harmless and told to simply memorize the vaccination schedule. Griffin actively participated in a Stop Vax Passports webinar, discussing her personal experiences treating post-injection women and defeating vaccine mandates for children in Louisiana. Hillary Blackburn, who happens to be the daughter-in-law of Senator Marsha Blackburn, works as a pharmacist and recently suggested through social media that vaccines may trigger autoimmune disorders. Raymond Pollack, a transplant surgeon, remains largely unknown to public health experts, with little available information about his vaccination-related positions or expertise. These 5 newcomers will join 8 other appointees selected by Kennedy this past June, following his unprecedented decision to terminate all 17 previous advisors. The Evidence Collective, a scientific oversight organization, has documented more than 50 factual inaccuracies from the first meeting of Kennedy's reconstituted ASIC group. The committee structure allows for up to 19 total members, meaning 6 additional positions remain unfilled. Under normal circumstances, the vetting and training process for ACIP advisors requires months or even years of preparation, a timeline that appears to have been dramatically compressed for these political appointees. Here's the question that should keep every parent awake at night. When political ideology trumps medical expertise in our nation's top health advisory committees, who really suffers? The answer is clear: our children, our communities, and our collective public health. What do you think? Are we witnessing a necessary correction to what some see as overly aggressive vaccination policies, or a dangerous dismantling of science-based public health protections? Should religious beliefs and political considerations influence medical recommendations that affect millions of children? The stakes have never been higher, and the American people deserve to have their voices heard in this critical debate.